Hello, everybody, and welcome back to the Malaria Dialogues. Just a couple of weeks since the first Malaria World Congress concluded in Melbourne. I'm back in Geneva at the World Health Organization, and today I'm going to have a conversation with Dr. Pedro Alonso, who's the director of the Global Malaria Program here at WHO headquarters. We're going to talk about the Malaria Congress. Dr. Alonso gave one of the plenaries. I want to get his impression on the Congress itself. But also we're going to talk about the priorities for malaria going forward in the rest of 2018 and beyond. So let's go and talk to Dr. Alonso. So you've just returned from the first Malaria World Congress held in Melbourne a week or so ago. What were your overall impressions and takeaways from the Congress?
So I guess first of all, it's always great to be in Australia, and it's always great to be in Melbourne, and the warmth of the people and the welcome was wonderful.
Right.
B, I think they really did manage to put together a very good, solid conference, which was ambitious, and I think it did succeed by and large in achieving what it set out to do, which was to bring the academic world, but also the implementers, academia, funders, and civil society, the incipient civil society of malaria, into one room. Right. So this being the first, understandably, is the beginning of a journey, not the fulfilling the entire potential of the concept. But I think it was an excellent meeting, well organized. Kudos for the teams that put it together, for the support of the Australian government. And it's a journey that we're beginning.
Right. Yeah, one of the rationales was to bring together those different groups of stakeholders and sectors. And in particular, you think they succeeded in that respect?
I think they succeeded by and large, yeah. I think they succeeded by and large. The one element that's always a little bit more complicated, and they did manage to table it very well, is civil society. And we often, and on the run-up to the conference, trying to think of the AIDS society and so on. Well, I think I did actually tweet a couple of messages around this during the conference. The problem with malaria is that civil society organizations have actually been very weak. And of course, one can speculate, why is it different between HIV and malaria?
Yeah.
I guess the most obvious one is that the people that are affected by HIV are actually rather different from the ones affected from malaria, which are often, particularly in Africa, the very young children in hard-to-reach populations, and they don't have a voice, and they have never really structured themselves. But seeing some organizations step up, and that this could be the beginning of a greater engagement in a more structured way by civil society, I think that's a great first step.
So you were pleased to see that
very
emphasis.
Much so. Yeah. Very much so.
Yeah. At the Congress, you highlighted in your plenary, I think it was on the first day, that there were kind of countries are increasingly divided into two groups. The 11 countries you mentioned accounting for 70% of the global burden, and then all these other countries, 44 of them, I think, that are making their way towards elimination. Do you think that the international malaria response is kind of split along those lines? And are we bringing those two ways of thinking together, or is thinking or focus still dominated by controlling malaria in the high burden countries? What do you think?
Well, certainly from the latter, I think, but let me be blunt, forthcoming in this, with regards to that latter response. Inevitably, yes, we have to keep our focus where the burden is highest, particularly because when we talk about the burden, that's where the deaths take place. In Africa, we have over 90% of all the deaths due to malaria, a disease that, let's not forget, is entirely treatable and curable. No one should be dying of malaria. Right. We have the drugs. Every parasite on this planet can be treated by drugs that we have today, and therefore no one should really be dying of malaria. So that clearly must be our number one. Now, the slightly metaphoric way of presenting the world is increasingly divided into two groups we have 90 countries that are still endemic for malaria, and 44 have less than 10,000 cases. And those we arbitrarily say, well, they are within reach of elimination. So about half of the world falls in that category. The other half has more than 10,000 cases, and in many cases they have millions of malaria cases, and those are the really hard ones. The two groups are equally important. The elimination space is gaining momentum. As we noted, this year we've certified Paraguay, the first country in the Americas since 1973 to be certified malaria. Hopefully Argentina will be certified this same year. Uzbekistan is likely to be certified this same year. Potentially Algeria at the end of this year or beginning of next year. Those are all fantastic news of what represents massive public health achievements. In Paraguay, I came to learn the country had been working on a malaria elimination program for 40 years. Wow. Across different governments, across different political upheavals and so on. Yeah. In many ways how Sri Lanka did, in a very complex situation, in the middle of civil unrest, but they were a very clear program. China reached 0 cases last year. Again, a long-term program. And so when we certify a country, we're celebrating not just the success, but the public health achievement of a long-term program that gets to such a conclusion. So that space is really important and is and will be the source of very good news. On the other hand, we have the very complex situation of countries which have millions of cases every year, right. Tens of thousands of deaths every year, right. and they do require special attention, because from a public health perspective, that must be our number one, right. Our number one priority, and so supporting countries as they go through their last mile, become malaria-free, certified and celebrate critical, we must bring down the intolerable burden of every year 500,000 deaths of this disease, or over 200 million cases of this disease.
It's good you mentioned the numbers. One kind of emerging theme, or something that was kind of percolating around the halls in Melbourne, was surveillance. Yeah. Some countries are doing very well, particularly in relation to subnational surveillance and data. Countries like Zambia. You're responsible for putting the World Malaria Report together, so I thought it'd be good to ask you, do we have the data we need, or what progress would you like to see in terms of surveillance?
So the answer is no, we don't have the data we need. Countries don't have the data they need. Right. And so when we were developing the global technical strategy 4 or 5 years ago, and I was then involved, I actually used to chair the committee that developed this before I actually joined WHO. And when talking to different communities and stakeholders and so on, we recognized that surveillance had not been sufficiently highlighted, and not enough efforts had been put into that. And so within what we call our 3-pillar strategy, which was then approved by the World Health Assembly in 2015, one of them is surveillance. So it's the first time that in a malaria document we bring surveillance to the upfront as one of our 3 key components in our global strategy. And we talk about surveillance as an intervention, because surveillance is not just about gathering data and then putting them in a national report or in the World Malaria Report. It's data for action, data to inform what should be done, and therefore data becoming an intervention, which allows timely planning, response, identifying where the interventions must go, measuring the impact of those interventions. So we believe that the next few years are going to be critical. And we now have the tools to potentially scale up. What we now call DHIS2, a platform for surveillance, is already becoming a small revolution. And countries are implementing them, easy to use, and that in itself is likely to have a major impact on our fight against malaria. So absolutely, surveillance will be essential.
Right.
It's going to be one of our key transformations, and as a side product, it will improve the precision of our estimates in the World Malaria Report.
Right.
Still a significant number of countries for which we report data on our World Malaria Report are still the product of modeling. Right. Modeling based on household surveys, cross-sectional surveys, in which we convert parasite prevalence to incidence, but it is not direct reports from countries because those data are still very weak.
And DHIS2 will give us just not more data, but more granular data?
Absolutely.
Yeah. Okay, great. You also mentioned about the kind of healthcare infrastructure in the GTS, and everybody knows WHO is focusing on UHC and the global program of work right now and implementing that. The global technical strategy recommends that we kind of integrate malaria into health systems in a smart way, it calls it. I just wondered how you think we're doing with that integration process. How's it going?
Well, I think it takes time, and it is challenging, and perhaps we don't often do as good a job as we should be doing of this. But and at times we and the broader community get engaged in these rather unhelpful discussions of verticalism versus horizontalism, and then actually coming out, well, it should be diagonal. Well, every vertical program has at any one point in time its integration into a given health system. And I think malaria overall doesn't do badly in most places. Sure, are sometimes campaigns to deliver bed nets vertical ones? Sure. Is healthcare provision fully integrated into the health system? Absolutely. Case management, diagnosis and treatment, where does it happen? At the health facility level. Or when there are capacities through different schemes of voluntary health workers or community health workers, it gets integrated there. So coming back to the very beginning, why do 500,000 children or people, mostly children, die every year? Because they're not accessing adequate diagnosis and case management, therefore, and treatment. And therefore, the expansion of our capacity to deliver adequate diagnosis and treatment seems to me essential. And that's a health system. It's strictly a health system issue. And therefore, one can never overemphasize how critical this is. And this indeed does entirely fit into our global program of work, GPW13, into our renewed focus on UHC, on our renewed focus of primary healthcare, and that will be inevitably the key way to make long-term sustainable progress in the fight against malaria.
I'm sure the powers that be in WHO are looking at malaria as an example of how to do.
Oh, absolutely. I mean, last Friday I was with the Director General and the Deputy Director General meeting on this. And of course, in many countries, malaria is likely to be the key component of a primary healthcare structure. In countries where 50% still on parts of the countries where malaria may still be 50% of all hospital attendance or consultations and treatment, it is going to help structure a PHC mechanism in country.
Well, it's been quite a year for the international malaria response, first with the Malaria Summit in London, Paraguay's malaria-free status, as you mentioned, then the Malaria Congress. I mean, momentum is clearly building after, I think, what you called the amazing decade. What do you think should be the main priorities for the international community moving forward, say, over the next 12 months or so?
I think we cannot drop the ball. And our last World Malaria Report, reminding us that we were at the crossroads, in many ways was playing this complex communication challenge of, on the one hand, we recognize we've lived through an amazing decade. 7 million deaths averted, 40% reduction in disease incidence globally. Never before had something like this been achieved. Right. And then comes, however, we are stalling. We have stopped making progress. And so while we've achieved the MDG goal, this is no time for complacency. We cannot drop the ball because we know malaria comes back, and malaria comes back with a vengeance. And so this is a critical time, and that is why events like the Commonwealth Summit, the Melbourne First Malaria World Congress, the 20th anniversary of the Multilateral Initiative on Malaria in Africa, and we celebrated in Dakar. Right. These are all key moments for us to take stock of what we've achieved, but at the same time recognize the challenges, the massive challenges that remain ahead. It's not an unfinished agenda, it's much more than an unfinished agenda. And how are we going to sustain that drive, that impetus? Because this is going to be a long race. This is not a short-term effort. This is going to be a long-term race if we want to defeat this very complex disease.
Yeah. And I must say, looking back at the time when the 2017 World Malaria Report came out, and you did strike that balance, it seemed at the time a kind of a slightly bold position for WHO to take, that, this was good, but a kind of a warning cry. But when you look back, almost every mention of malaria since has referenced that, and this being at the crossroads. So I think that was absolutely right. I don't suppose it's going to change much for the 2018 report, but we look forward to seeing what that has to say as well.
No, I mean, again, because we don't have such brilliant data, it is unlikely that there will be any significant change. And frankly speaking, nothing much has changed between this year and next year. I think what we're trying to come to terms is what is the response that we need to put in place to, again, bend the curve. Right. But I believe, coming back to your statement on the World Malaria Report, I'm a strong believer that WHO has to be rooted on best possible data and say what it says based on the evidence, and nothing more dangerous than complacency and clearly the signs were there already for the previous 2 or 3 years. In many ways, this did not come in any way as a surprise, but it was the first time that the data clearly showed that actually not only have we stopped making progress, there was evidence of significant increases in a number of places. So I think it is part of our duty to raise a red flag and say, my friends, we all as a community need to reinvigorate our response.
Yeah, no, and absolutely. I think that's exactly what WHO does for the entire community. So thank you for that. And thank you for the conversation today.
Oh, thank you. Great pleasure.
Look forward to watching what the Global Malaria Program does and staying in touch. Thank you.
We are as good as the rest of the community is, and we do this. Whatever we do it in partnership and to hopefully best serve the member states. So thank you.